Good afternoon. Welcome to the 7th Annual Oswego County Substance Awareness Family Education Safe Fair. I'm Teresa Wilson, President and founder of the VOW Foundation, and your host and facilitator for the Safe Fair. Our next presentation is Poison Prevention Updates during the COVID pandemic with Lee Livermore, Public Education Coordinator with the Upstate New York Poison Center. Lee has a bachelor's degree in business and has several certifications in communication, training, organizational development, and personality profile assessments. Lee has more than 18 years of delivering poison prevention training programs and presentations to the general public, community-based agencies, primary education schools, colleges, and universities. He is skilled at presenting the topics of drugs of abuse, train-the-trainer programs, poison prevention awareness programs, and is active in developing partnerships with community coalitions with the 54-county coverage area of the Upstate New York Poison Center. He's a highly sought-after guest speaker and is known for his energetic presentations. Welcome, my friend, Lee Livermore.
Oh, thank you, Teresa. It's such an honor and a pleasure to be here today. Such a great health and safety fair that we're having. So yet again, another PowerPoint presentation, but I will do my darndest to make this as entertaining as possible. I'm going to give you a little bit of a mix of what the Poison Center is, a review of how to prevent some poisoning. And I'm going to dive a little bit deeper into what this whole coronavirus stuff is all about. So to begin with, our Poison Center is hosted by Upstate Medical University. And we are so honored to be supported by the university in so many different ways. And our Poison Center is one of two poison centers in New York State. The Upstate New York Poison Center covers 54 out of 62 counties in New York State. And the second Poison Center is located downstate in New York City. So who are we? Well, basically, we're the experts in toxicology. We cover everything that could be harmful to human beings, including what is happening in the pandemic, coronavirus pandemic that we're experiencing now. But I want to give you a little bit more in-depth as to the Poison Center, who we are and what we do. So we are a toll-free telephone triage advice center, and we're staffed by experts. I've often asked my audiences, who do you think answers the calls at the Poison Center? And some people have said, well, you know, maybe minimum wage people, people in other counties, college students. But actually, the people that answer the calls at the Poison Center are highly trained experts in the field of toxicology. RNs, pharmacists, and doctors all serve at the Poison Center. And as I'd mentioned already, our coverage area covers 54 out of 62 counties in New York State. So here's an image of the map, and that's everything in our coverage area for both education, poison information, and poison emergency calls. We've been at this business for a very long time, a little over 63 years, because our Poison Center originated back in 1957. So that really covers about a 7.4 million population base. We have over 125 healthcare institutions that report to us, and our services are available 24 hours, every day of the week, every day. And we're such a vital source that when you call, you are going to get an expert. So we respond to poison emergency calls, poison information calls, and the service is free and confidential. By dialing an 800 number, you're able to reach an expert who's going to give you the best, most up-to-date information on either your question or your poison information emergency. The most important thing I think to say about poison centers is this wording, real-time tox surveillance. So what does that mean? Well, every 8 minutes, all the data from all the calls from every poison center in the United States, of which there's 55 poison centers, gets uploaded into a national database. And this national database is what we call the only real-time tox surveillance system in the United States. It's utilized by the Centers for Disease Control, Health and Human Services, federal governments, state governments, local governments. And what we're able to do is we're able to take all of the data from all of the poison centers, upload it into this database, and be able to tell where toxins and poisons and exposures are happening all throughout the United States. One of the important things for this is that poison centers have also been utilizing this system to track all the coronavirus calls that have been coming in through the all over the United States. Such a very important and vital service. And I'll talk a little bit more about that when I cover the points on coronavirus. So if I pulled the curtain back and I showed you behind the scenes, we do a tremendous amount of data collection, outgoing education, research, and also we offer training. This is one of the education efforts that most people are not aware that we teach doctors, we teach pharmacists, we teach EMTs, nurses, educators. People from all walks of life are able to come to the Poison Center and get an education on toxicology, which helps enhance their roles in every area that they play, from medicine to public health. So what do we do besides just give medical advice? Well, we record information, we track morbidity, mortality, and more importantly, we analyze trends. So one of the key pieces is we've been analyzing this coronavirus trend that's been happening in the United States, staying up to date with the signs and the symptoms, as well as the treatments and the vaccines. And all of this information is reported in a real-time database to our association that governs poison centers, and that's called the American Association of Poison Control Centers. So the special services we provide: triage for poison calls, information management. We can identify over 500,000 products that are manufactured in the United States and identify exactly what the potential toxic or non-toxic principles that are in that particular product. We do tablet and capsule identification, predominantly for healthcare professionals and emergency responders. We don't normally provide this to the general public for their own safety. And we also provide information on drug interactions. So one of the populations that call the Poison Center are seniors. And very often they intermix medications or potentially mix them with over-the-counter medications. And they could call the Poison Center and we could analyze the medications they're on, the over-the-counter medications, or even some of the dietary supplements, and let them know what the potential dangers or safety might be by drug interactions. So our staff is by C-SPIs, which is a certified specialist in poison information. Most of them are registered nurses and pharmacists. We also have toxicologists, and there's 3 of them that are pictured in this slide. And these are doctors especially trained in toxicology of pediatrics, environmental, occupation, and also pharmacology. And then, of course, you have myself and my other colleagues, Gail Bannock and Mary Beth Dyer, who do the education outreach throughout the 54 counties of our coverage area. So what does this mean? We get about 80,000 calls from the general public to our Poison Center every year. And this amounts to anywhere from 125 to 150 calls per day. Now, during the COVID pandemic, our calls exploded because people were wondering, how can I keep myself safe? How can I get tested? Where do I need to go? And the Upstate Medical University set up a very special separate coronavirus hotline, which has served all of New York State, most predominantly in our coverage areas of Onondaga County, Oswego, Madison, Cortland, Broome counties, but we have acted as a service to counties all throughout New York State. And that really exploded that 80,000 calls that we normally get from the general public. So what is a poison? Quite simply, a poison is anything that's harmful to us. It could be something as simple as breathing in fumes from a paint can, or getting stung by a bee or bitten by a mosquito, to getting something sprayed or splashed on our skin, in our eyes, or something that we might even ingest. So when we look at all of those routes of exposure, eating and drinking typically is the #1 form of exposure. And when I get into talking about some of the updates, especially on hand sanitizer, you're going to understand the importance of this. And then, of course, things that we get on our skin, in our eyes, things we might breathe in, and then bites and stings. So most of the poisons really happen in the home, although we're getting a lot more calls from the emergency rooms because people are showing up in the emergency room with very serious exposures. As Teresa mentioned, we do a lot of programs on drugs of abuse and trying to keep people safe from things like synthetic drugs. And one of the other fantastic programs that you saw this morning, this whole issue of vaping and all of the dangers and the chemicals and the mixtures that possibly are in those devices. Well, the Poison Center and the hospitals are handling all of these type of calls. So what are the top 5 calls we normally get? Things that are on sedatives, hypnotics, antipsychotics, analgesics, depressants, alcohols, and cardiovascular drugs are the list that cover for adults. But what might surprise you is the list that we have for children. So cosmetics is the #1 product. Now, most of these are really non-toxic, but it's the availability of the products like hair detangler, hair products, bath products, colognes, perfumes, any of the things that we might have around the house, nail polish remover, nail polish, baby powder, baby oil, all of these sort of things are easily accessed by young kids, and if they're used in the wrong way, could create a poisoning. And then, of course, there's cleaning products, and we know with the COVID pandemic, everybody is trying to get their hands on cleaning products, which increases the opportunity of a potential exposure. And then analgesics, pain relievers, topical preps, and foreign bodies round out the list for children. Most of these things are accidents. They're not supposed to happen. And so when an exposure happens, by having the number of the Poison Center handy, programmed into your cell phone, you're able to reach the Poison Center and get an expert within moments. So what are the #1 reason why a poison happens? It's the look-alike factor. And I promise I'm going to amaze you when I show you some of the hand sanitizer products that were the cause of a lot of exposures. But when something looks like something else, that's the #1 reason a poisoning can happen. So when we look at things that are like candy or medicine, and anytime we take a product out of its original container, it becomes an opportunity for an exposure. So I do also want to mention, now that a lot of people are working from home and kids are being homeschooled, we're spending more time in our homes than we ever have before. We're bringing in more cleaning products, and the opportunity for an exposure has greatly increased. When we look at some other things like liquids, pine cleaner and apple juice, again, when we take the product out of its original container, there's no label, there's no way of identifying it, other than if somebody happens to smell, drink, or get the product on their skin. Medicines and candy continue to look a lot like each other, and it's very easy for a young child to make a mistake. Or even when you take medicines that might look like another medication, older adults have a difficult time understanding the differences. We look at something very dangerous like antifreeze. And as we're heading into the cold winter months, we're going to have problems with carbon monoxide exposure, faulty heating systems, extra liquids that we're putting in our car to keep our cars running well and warm. Again, we need to keep these products up and out of the way, because when they're taken out of their original container, it becomes an opportunity for an exposure. Windshield washing fluid and blue Kool-Aid is another great example. Then we look at laundry detergent products, and you might notice in the midst of all this candy is a laundry pod. And every year there's thousands of calls that are made to poison centers over laundry pod exposures. We're getting better at creating child-resistant packaging for these products, but still, it smells good, looks good, it feels good, like it's fun to play with, and we still get a lot of exposures over it. So moving into COVID-19, really, what is a virus? And this is a very brief example, but I thought it was important to bring us through the chain. How did we get to where we are today? We're going to cover epidemics, pandemics, looking at testing and next steps. So what is a virus? Well, a virus is this microscopic parasite, generally much smaller than bacteria, that has to have a host body in order to live. So we know things like the common cold and SARS virus and the standard flu. Well, these are all viruses. And the new version, the COVID virus, is a novel SARS virus. And yet again, it's proven to be very, very deadly. Where do they come from? A lot of viruses are transmitted from rodents and from bats, from birds. They're transmitted into other animals, as we can see here where the SARS-CoV virus come from. We had the swine flu. We had the MERS virus, which came from the Middle East, and also camels. And then the SARS-CoV virus. There was also bovine viruses that have come from cows. So there's lots of products in animals in our environment, and it's very easy to transfer viruses. The little picture on the left there shows the coronavirus. And the reason it's called corona is because of those spikes on there. And it comes from the Latin word meaning crown. And it's one of the ways that we identify this particular virus. So what's the difference between an epidemic and a pandemic? Well, an epidemic is something that breaks out quickly, spreads quickly, but we're able to contain it. Where a pandemic is something that is of epic proportion. As we're seeing, this is a worldwide pandemic. And here's a picture of what it looked like back in 1918, 1920 during the Spanish flu. We're so fortunate to have all the medical and protective equipment that we have today. But imagine living in 1918 and getting exposed to the flu. Now, this is a makeshift hospital in a warehouse, and they're treating everybody without proper ventilation, without proper sanitation, without protection. And this was why that flu, the Spanish flu, is often compared to the coronavirus flu that we're facing today. If we look through the ages, I've already mentioned, we've had the Asian flu, AIDS pandemic, swine flu, Ebola, the Zika virus. And why they call it SARS is because it's severe acute respiratory syndrome. And then I mentioned the MERS because that came from the Middle East respiratory syndrome. Here's a map of the world just showing you how easily it is to transfer diseases in our global world that we're facing today. And again, here's a picture of the coronavirus. Now, this is an animation made up, and it shows you the protein spikes, those crowns. And what those crowns do is they attach to other cells that are incredibly vulnerable, like the cells in our lungs and our respiratory system. Once they attach, it drills down into the cell and releases this RNA, which replicates itself and then causes the virus to replicate and to propagate in the body. And this is why when somebody gets an exposure, we have anywhere from 2 to 14 days before somebody might show signs or they might get tested and show positive for the coronavirus. So this was some of the early signs of the outbreaks back in March. The red dots show you where we were noticing these pandemics around the world. Now, this colorful gap really just shows you, we know that the virus originated in China, but mostly what happened in the United States, the transfer of the virus came from the European countries. And in this particular sense, it was important because New York City was accepting more than 1 million people from European countries. And that's where we believe the pandemic happened to affect New York State. And it was also one of the major breakout areas in the United States. So how do they test for this? Well, because it's a respiratory virus and it's part of our sinus and our breathing system, they have to stick a swab way in the back of your sinuses in order to be able to grab a sample. And then they have to protect that sample and send it to a laboratory for testing. And so this is called the RT-PCR test, which is a polymer chain reaction test. And that's mostly what they're looking for. And it's so easy to transfer this virus because it's the air that we breathe, and it's the possibility of being infected by somebody sneezing, coughing, or breathing on surfaces. So how do we do treatment for this is a very important key thing. So there were a couple of videos that I really don't have a chance to show you right now, but most of the treatment is that we have to keep people in quarantine. We have to protect them from infecting other people. Other people where the respiratory system gets compromised, they actually start building up fluid in the lungs, and that is a very dangerous thing. It affects their breathing, which affects their blood system, which affects their central nervous system, their immune system, and that's why this is such a dangerous disease. Ways that we can protect ourselves from it is through lots of hand washing, disinfecting, and wearing masks. So prevention. One of the dangers I mentioned in a look-alike factor is there were companies trying to capitalize on hand sanitizer. So these particular products, I don't know about you, but to me, they look like juice boxes. And look at the cartoon characters that are on there. Minions, popular cartoon characters from today, even Hot Wheels, toys that kids play with. But this is actually a hand sanitizer, which is something that's designed to be used on our hands as a way of protecting ourselves from carrying germs and touching our eyes, our nose, our mouth. But we actually had exposures where some kids were drinking this and then calling poison centers because they were getting an exposure. So when we look at some of the vaccines that are out there or being developed, now, a vaccine is one of the ways that we can protect ourselves. It hasn't been proven yet, and it's going to be a long time before we could do this. And until we can get a vaccine that's going to work for us, we have to practice all of the other things to protect us, ways to keep us safe from poisons and toxins. So just a quick update, there originally were 135 trials that were just getting started. And as you could see, we really don't have any virus that's approved now, but it has to go through all of these stages to prove that it's safe for people to use and help to keep people safe. It's going to be a while before it'll happen. So one of the ways, hand sanitizer can be toxic. Some of the versions of hand sanitizer have a high level of alcohol, which in some cases, if we're put in the mouth and absorbed, it could actually create a toxic alcohol exposure. So when we look at some of these brands, Bloomin' has been identified by the FDA that these were products that were manufactured in countries like Mexico, And they don't list the alcohol ingredients, but what was happening that they think that how they were manufactured, instead of creating a safe alcohol, it was actually creating a wood alcohol. And wood alcohol, if it gets on your hands, it's absorbed through the skin, or if people were getting it on their face and their eyes, that it could actually cause organ failure and cause blindness because of the type of alcohol that's in it. So we were getting cases where people were buying hand sanitizer and using it excessively and then ending up with problems and in the hospital. So some of the updates is that since March, the poison centers have received a high level of exposure calls, over 45,000. Most of them were involving cleaners and disinfectants. So people were over disinfecting, they were over cleaning, and even hand sanitizers were accounting for 36.7% of the increase in calls. This was for a large age group, but poison centers cover every age group from the cradle to the grave. So we want to be careful when we're looking at children under the age of 5, which was representing a high level, because we're trying to keep their hands safe from germs. And unknowingly to us, products got on the market which were actually dangerous. They have now since been pulled off the market, and we're continuing to monitor it. So tips for hand sanitizer is that you always want to read the label and check the pocket or check the product, and you can compare it with a list that's on the FDA website. And all you have to do is just Google or go to your search engine that you use on your computer, put FDA hand sanitizer, and it'll bring you to the place where you need to look up a list of the hand sanitizers. Now, don't overhandle bottles of hand sanitizer. Wow, that was tough to say. To young children, because it's easy for them to put it on their hands, and before it has a chance to fully absorb, they potentially could get it in their mouth, in their eyes. So it's always great to have an adult supervise them. So a guide for this is that really use more hot soapy water is a great way to disinfect. We don't always have to use an alcohol hand sanitizer, but in the event that that happens, well, it's great that we're able to have hand sanitizer. So cleaning products with bleach and disinfectants is that we need more time for cleaning, and we need to reduce the risk of poisonings. Cleaners cut dirt and grime, and they also disinfect and kill germs, either bacterial or viral, but not both. So make sure the cleaning products that you're getting are safe to use, and use them according to the labels and disinfecting. Reading the label perhaps is the #1 most important thing I can tell you about using any product in the household. Another thing you want to be careful about is alcohol. Since we're talking about alcohol that's used in hand sanitizers and the dangerous wood alcohol that was discovered in some of them, there's also more ethyl alcohol because more alcohol products are in the household. Now, I'm not saying it's going to be in everybody's home, but I definitely want you to make sure that you're keeping products like alcohol, beer, wine, spirits up and out of the way, because it's very easy for a young child to want to imitate adult, or maybe if somebody sets a drink down, it could look like a delicious drink to them and they may want to drink it. Some of the effects from alcohol can be sleepiness, stirred speech, unsteady walk, and maybe if they got too much, some vomiting. You also want to remember some of the spirited alcohols are flammable, so you want to keep those away from open flames. So let's briefly talk about prevention. Well, some of the ways that we can prevent any of these sort of things from happening is to make sure that we're putting products up high and out of the way. Make sure that in some cases, we're actually locking some products up like medications so that they don't get confused with medicine for young kids. We can use safety locks on doors. because we keep most of our most dangerous cleaning products right under the kitchen sink, and that's easy access for young kids. I think the number one item I could say that's going to produce the best effect for you is to have the number for the Poison Center into your phone, your cell phone. And that number, of course, as you can read, is 1-800-222-1222. This way you will have access to experts 24 hours a day, every day of the year. So why do we do all of this? We want to keep children safe from poisons. And most importantly, with what little information I shared with you today, we know we're living in a pandemic. We know we're living in difficult times. And so what you're going to learn from this health safety fair today is that knowing changes everything. And I want to thank Teresa, and I want to thank all of my fellow colleagues for the time and volunteering for today's programs. Teresa?
Thank you so much, Lee.
Wow, it felt like a roller coaster, I'm telling you.
That was great. That was perfect. Thanks again, Lee.
You are welcome.
Always great to see you.
Such a pleasure, and I wish you much success with the rest of the programs today.
Thanks, Lee.